Hi guys, we're group 3 and today we're going to be discussing health issues among low-income children and rural populations. My name is Lily.
My name is Sachi.
I'm Zoe.
And I'm Anjali.
So first we're going to go over an outline of what we will be presenting. First, we're going to discuss health issues and challenges among our population. Then we will discuss risk factors, current support programs, and finally recommendations. Nearly 1 in 5 children in the United States live in rural areas. Unfortunately, rural children experience significant health issues and health care disparities compared to their urban counterparts. If you look to the left, you can see a graph by the Census Bureau that displays child poverty rates across America. You can clearly see that there are higher poverty rates in the South and lower Midwest. These are indicated by the purple colors. If you look to the right, you can see a graph by the first 5 years fund. This graph displays childcare needs in rural versus urban communities. You can see that rural needs, which are indicated in red, greatly exceed urban needs in certain states. The states that have the greatest difference are Idaho, Iowa, Montana, Nebraska, Wisconsin, and Wyoming, which are all more rural states. The NCSH has found that children living in rural areas are more likely to be poorer than children living in urban areas. Of children living in small rural areas, 26.2% lived in households with incomes below the federal poverty level, as did 26.6% of children in large rural areas. As a result, children living in rural areas face far more health challenges and are more likely to experience chronic disease and death compared to children living in urban areas. They are much more likely to have healthcare issues related to firearm injuries. This may be due to easy access to firearms, which may be more necessary in rural areas for protection and livelihood. Rural children are also more likely to experience mental health issues, such as depression, and they are also more likely to commit suicide. They are more likely to experience oral health issues as well. This may be due to the fact that children in these areas are less likely to receive preventative health care and dental visits. Lastly, these children are much more likely to be overweight or obese, which means that they have a body mass index at or above 85, the 85th percentile for their age and sex. More than 1/3 of children in rural areas meet the criteria for obesity.
Thank you, Lily. So now I want to talk a little bit about risk factors and causes of vulnerability for these children. So, like Lily said, rural children are at a disadvantage. And there are four primary reasons for this. Number one is inadequate transportation. A lot of these rural populations do not have easy access to nearby hospitals, and also they are largely dependent on their parents to provide transportation, which leads to number two, which is that a lot of these parents are working long hours to provide for their families, and they do not sometimes have time or resources to take their children, for a number of miles to nearby clinics for regular checkups. Um, Children are much less likely to receive preventative care. Whenever you think of children, you don't think of planning out, screening for heart disease or stroke symptoms. So children are much less likely to receive preventative care, which puts their health at risk. And then number four is that parents have much more control over their health decisions during these years. So that will mean things such as they make the final say on whether children get vaccinated or not. Next slide, please. So here is a map showing the average minutes of car travel time to the nearest hospital by census region. And as you can see that rural inhabitants, specifically people living in the northern plain states, have the longest travel times to the nearest hospital. So this is of concern because it shows that children who are living in these specific regions have unequal access to healthcare to healthcare. And here is a data from the AAP showing children and COVID-19 vaccination trends as of 2023. As you can see, as of May 3rd, 2023, there are still 56% of unvaccinated children. These are children from the ages of 6 months to 17 years, and only uh, and still there are 56% that have no vaccine.
Thank you, Sachi. I'm going to be discussing different support initiatives that currently help low-income children have access to healthcare and other necessities. Firstly, the National School Lunch Program and School Breakfast Program in rural schools helps to ensure low-income children have access to nutritious meals during school day by providing free or reduced rates. Secondly, investing in early childhood education programs such as Head Start and Early Head Start in rural communities helps to support cognitive, social, and emotional development of children from birth to age 5. Head Start is federally funded in the US and provides comprehensive early childhood education, health, and nutrition, and family support for low-income children. Some key aspects I want to touch on of early Head Start and Head Start are early childhood education. Head Start offers high-quality preschool education to children aged 3 to 5, focusing on school readiness skills such as literacy, numeracy, and social emotional development and other cognitive skills. Then it also provides health and nutrition services. It provides healthcare services including medical, dental, vision, and mental health screening, as well as immunization and follow-up care for these low-income children. And then lastly, rural health clinics, increasing access to healthcare services through rural clinics and telemedicine programs, particularly for preventative care, mental health services, and chronic disease management, such as obesity and other heart-related disease. For these low-income children and their families. Many of these rural clinics offer like sliding fee scales or discounted services based on income, making healthcare more affordable for low-income families. This financial assistance helps ensure that the cost is not a barrier to accessing essential health services for low-income children. And additionally, there's also access through Medicaid and other programs such as CHIP that allow children in rural communities to receive the essential healthcare services they need.
Thank you so much, Zoe. So springing off of what Zoe has discussed, I'd like to discuss some of the recommendations that our group has for furthering healthcare access to low-income rural children. The first being community-directed healthcare interventions. Studies have shown that if the community is involved in creating the decisions made for these healthcare interventions, it's more likely that they will use these interventions and also feel as though that they have a stake in making sure that these interventions actually work. In regards to school-based healthcare services, Zoe briefly mentioned some of the programs that currently exist for low-income children, specifically Head Start programs. These kind of services, whether they're healthcare or non-healthcare, tend to end up helping students and children's health by increasing their access to nutritious foods, by increasing their access to the information that they need to know about keeping themselves healthy, and by just straight up making sure that they have access to the healthcare that they need. Mobile health clinics is another thing that has been really helpful in creating more access in low-income communities for both children and adults. Because providers are going into communities and serving them rather than having these communities come out to specific areas. As Sachi talked about, there are specific areas, especially in the Midwest, that have no to very little access in a 10-mile radius. So mobile health clinics help take that distance out of the equation so that people have the ability to check up on themselves in a way that is more accessible to them distance-wise, and also hopefully in a way that makes them feel taken care of. And then in regards to telemedicine, this is something that has especially been been more popular since the COVID-19 pandemic has occurred. Telemedicine has been a great way to connect providers with their patients in a quick and easy way, especially in regards to preventative care, as Zoe mentioned. Telemedicine has been a way for patients to connect with their doctors over Zoom or over the telephone, and talk about their symptoms, talk about how they're feeling, and potentially get all of the recommendations that they need without ever having to step outside of their door. So it's a great way to increase access while also making sure that costs are a little bit lower and people still feel as though they are connected to their primary health care provider and potentially specialists such as mental health care providers. And our discussion questions for the group were, to what extent has the Children's Health Insurance Program been effective among rural populations? And how could this program be improved? And then our second discussion question was, what approach should be used to solve the issue of chronic diseases, such as obesity, among low-income children living in rural communities? And that's everything that our group has for this presentation. Thank you so much for listening, and we hope that you learned something about increasing medical access to low-income rural children.